Welcome to the Global Health Program online orientation. We're happy you guys are all able to make it today, and we look forward to meeting you during the school year. I'm Brittany Wright. I'm one of the Global Health Program advisors, and I've been an advisor since the Global Health Program began in fall of 2014, so we're a pretty new major here on campus. And I received my Bachelor of Arts in Psychology and a minor in Sociology from UC San Diego, so I'm an alumni from here, and also received my Master's in Arts from in Education from Point Loma Nazarene in Counseling and Guidance.
Hi everyone, I'm Erin Morey. I just started here in the Global Health Program about 6 months ago, so I'm new to UC San Diego. This is going to be my first fall, so I'm really excited to be working with you all. I went to San Diego State for undergrad in Child and Family Development, and then I did my Master's in Post-Secondary Educational Leadership with an emphasis in Student Affairs at San Diego State as well.
Great. And here is our Global Health Program Advising Assistant, Liberty. Here we go. Okay, so some of you will get the opportunity to meet Liberty Bell when you come in for advising appointments, and she also is known to attend a few Students for Global Health, the student org, GBM, so hopefully you'll be seeing her soon. So, as you have just met, I'm Brittany Wright. I'll be leading most of the presentation today, and Erin Morey. And Liberty Bell, our director is Professor Thomas Chordash, and he is a professor of anthropology, and he is the one who started the Global Health Program. Okay. So today we're going to go over a few different categories about the major, and we're also going to learn about understanding what global health is as a discipline, your major requirements, the field experience requirement, some study abroad options, tips for success, and then we'll end with a Q&A session. Hopefully all of you have gotten or read your email about the academic advising guide for 2017-18. This is available online, and a lot of the material that will be covered here today is also found in this guide. So you can go ahead and flip through. There's a table of contents, and it gets pretty detailed. So this is a good place to check out before you start the school year. Information even on the core course descriptions, the field experience, planning out your courses and whatnot. So that's a really good resource for you to have on hand. So part one, understanding global health. So the standard definition for global health is that it's an area of study, research, and practice that places a priority on improving health and achieving equity and health for all people worldwide. It emphasizes transnational health issues, determinants, and solutions, and involves many disciplines within and beyond the health sciences, and it promotes interdisciplinary collaboration. It's a synthesis of population-based prevention with individual-level clinical care. So as you can already see from the definition, global health is a very diverse area of study, and that's something you're going to be learning more about in your classes, is the different areas and all the different disciplines that are brought in to kind of make global health. So when you're studying global health, you're going to be getting an insight, understanding of factors related to illnesses, health, and healing from an interdisciplinary perspective. So this is going to be taking regional interest and cultural interest into consideration, and is also ignores national boundaries. So when you're thinking of global health, you're looking at the health of the world. You're not looking at health in California, health in the US, health in Mexico. It's more of a globalized, holistic approach. So some of the topics that you're going to cover in your courses are going to be anything from healthcare, health education, environmental effects on health, infectious disease, reproductive health, mental health, health inequities, the outcome of natural disasters from political violence, and indigenous healing practices, to name a few. And I really like this little illustration on your right where you can see some of the topics. So there's anything from human rights and food policy to maternal health. So that covers the topic of global health. Now let's get into the actual academic advising and your major requirements. So when it comes to advising at UCSD, there are two sets of advisors that you're going to meet with. You have a college advisor and a major advisor. So your college advisor helps you on questions related to your GE and transfer credits. If you want to petition a course for your general ed requirements, you would work with them. And also regarding university policies. So if you have a question about graduation or your max units, this is who you would go to. For your major advisor, you would be meeting with us to go over your major requirements. And if you're petitioning a course that's specifically for your major. So whoever you're petitioning the course for, that's who you're going to want to meet with. We also advise on the field experience requirement. And if you have any questions about specific questions for study abroad within the major, and also if you're applying for independent research or something specific like that. Right now, the ways that you can contact us is by stopping in during our walk-in advising hours. So right now, our walk-in advising hours are Tuesdays and Thursdays from 8:30 a.m. to 11:30 a.m. And we're located in the social science building. So we're in a building next to REMAC, and we're on the second floor in the anthropology advising office. You can also send us a message in the VAC, which is the Virtual Advising Center, and we're happy to answer your questions through there. And if you're not able to come in during walk-in advising hours, you'll want to email ghpadvising@ucsd.edu to set up an appointment and include the information, your name, PID, why you are meeting with us, and 3 appointment times that work for you. If you go to the Global Health website, which all the information on the PowerPoint today is also on the website, we have our advising hours listed there. So you'll always want to check in with those, but we're pretty good about notifying you all if there's any changes. Okay, so let's dive into the actual requirements of your major. So the Global Health major has 17 courses. So at least three of those will be upper division, and the rest, or I'm sorry, 3 of those will be lower division, and the rest would be upper division. So you will take either the history of public health or the introduction to global health, or you will take one of the following sociology courses, so Soc 30, 40, 70, or Phil 26. So those are 2 separate requirements. So requirement 1, requirement 2, and then you also have a statistics course. When something is said that it's accepted by petition, that means that it's already been reviewed by the Global Health Program Director and will be accepted. You just have to follow our process to have the course show up on your degree audit. So typically the reason that is that it's a new course, or it's a course that someone just petitioned and we're now accepting. So we haven't had it we have to apply for the academic senate to accept those courses in the catalog. So that takes about a year. So in the meantime, that's why you would find that you need to submit a petition. But if it says accepted by a petition, it will be accepted. So you don't ever have to worry about whether or not it'll be accepted for you. The course descriptions are also found online and in the advising guide. So on the Global Health Program website, if you click on courses here, then you can see all of the course descriptions available on this page. So that's a good place to check out when you're starting to think about what classes you're going to be enrolling in. So for your upper division core, the 3 core courses that everyone will be taking are Global Health 148, Global Health and Cultural Diversity, Global Health 181, The Essentials of Global Health, and MGT 173, Project Management in the Health Services. So Global Health truly is interdisciplinary. Just looking at the core courses, you're going to get a perspective from the School of Medicine and a perspective from medical anthropology with the Global Health 148 course. This one's taught by a medical anthropologist. And in MGT 173, that's a course from Rady School of Management. So you're going to be getting a business perspective as well, because when you're thinking about how to be productive in solving problems in global health, you really need to have an understanding of all the different parties involved. And business is one of those really important aspects of getting things done in the real world. So that's an awesome course. You'll also have to take one policy analysis course. So there's a list online of all of the courses that are accepted for that. One new one that we have this fall, it's really awesome. It's Global Health 160. It's Global Health Policy, so very specific to what you're interested in. And it's taught by Professor Tim Mackey. He is a faculty member from the School of Medicine. So aside from that, you'll also, in your senior year, be taking a Global Health Senior Capstone. So that's a 2-part course. So you'll take Global Health 150A in winter and Global Health 150B and spring. And during both of those quarters, you're going to be preparing to write a senior thesis, and we're going to get a little bit more into that. And then finally, you have the exciting part, the electives. So you're going to have a lot of choices when it comes to your electives. You have 3 required biological science electives. So 1 must be upper division and 2 may be lower division. All of the other electives have to be upper division. So unfortunately, if you're a transfer student and you have a course that you think sounds perfect to fulfill one of these electives, unless it's biology, it would not be accepted because all transfer coursework comes over as lower division, unless it's from another UC. So you'll do your 3 biological science electives, your 3 medical social science electives, a medical humanities, and a global processes. In addition to that, everyone will be completing a global health field experience requirement, which will be 100 hours in the field, and that can be domestic or abroad. And we're going to get a little bit more into that as well. A tip from a global health student is when choosing your electives, remember, this is your chance to take courses that influence your path of study. If there is a global health topic you want to specialize in, take electives that cover that interest. Elective courses can also help you find out what you're passionate about. So if you go onto the major requirements page for your global health major, you'll see that under each elective category, there's quite a few options. So under your biological sciences, you have anything from anthropology to a long list of biology, cognitive science, environmental studies, public health, human development. Your medical social sciences, you can take classes from many different departments, so that's another good one to get some exploration in. And same with your medical humanities and global processes. One thing I want to point out to you is there are some courses in especially the global processes category that also overlap for your DEI course. So if you need a DEI course, that's a diversity, equity, and inclusion course for your college GE requirements, you can overlap that with your global health major. Okay, so now let's talk a little bit about the senior experience in the Capstone. So the Capstone is a 2-quarter seminar course, so Global Health 150A and 150B. During the first quarter, you're going to be doing readings and discussions in fields related to your interest. So you're going to be building the material in the first quarter. And in the second quarter, you're actually going to start developing the content for your thesis and doing workshops with your class members to get feedback from them. You'll also prepare a research poster project. So on the right here, you can see this is alumni Crystal Quick from 2016 with her poster here. And then at the conclusion of that, you're going to turn in a written senior thesis. So it's about 10,000 words. And this is really nice for you to have as a credential if you're applying for a graduate program or med school, to show them that not only can you conceptualize biological and medical processes, but you can also communicate your research and your interest, which is something that many employers and med schools want to see in graduate programs. So the capstone is typically based off something from your field experience, and that's not always the case, but it's just a starting point. So some students may do their field experience at a clinic and they've observed something working with a refugee population and they want to dive more into that. But say your field experience wasn't that inspiring to you and you realize that's an area you don't want to focus on, and that's sometimes what happens. You'll do your field experience and realize, you know what, I don't like research, or I'm not as interested in that as I thought. You can also find a topic that's been passionate to you, and I guarantee by the time you complete all the core courses, you're going to be introduced to some material that strikes some passion in you. And then at the conclusion, during the spring quarter, you'll also present your research poster at the Horizons of Global Health Research Symposium. So this is an annual event that the program has, and it's an opportunity. So we have all the seniors sharing their senior thesis posters, and then we have a keynote speaker who comes in and addresses a relevant topic in global health. Our past topics have included global mental health or climate change, so we'll stay tuned for what's coming up for the years while you're here. So for some of you who are interested in finding out more about the senior experience in the capstone, here's a few examples of some previous thesis topics, and yours can be along the lines of whatever you're passionate about, like I said. And if you're interested in learning more about the different, what is a poster abstract, the Global Health Horizons page. So actually, if you go to events and the Horizons Research Symposium, you can scroll down, and under past events, you can see the abstracts of previous seniors' abstracts, thesis titles, and whatnot, so you can kind of get an idea. So building a cultural competency program for refugee healthcare providers in San Diego. The effects of war and forced migration on refugees. So as you can see this year, there was quite a bit of interest in refugees, but also mental health and substance abuse, women and children's health, community empowerment. So those are a few examples of some senior thesis topics. Okay, so another thing that we have some students interested is enrolling in independent research. So we call this Global Health 199. So to get started, if you're really interested in getting involved in research, there's a few ways you can go about this. One is to look for opportunities in the Global Health Program newsletter. And on top of that, I often send out email blasts to you about opportunities that I hear about. Some of those are research-based, some are volunteer. If you're working with a faculty member who's doing work within health or global health, then you could potentially turn it into an independent research course. So by turning it into a course, you have to have a faculty advisor who will sign the form for you. And in addition to that, you'll also be turning in a 10 to 15 page research paper. So that's something that you want to establish with your faculty member prior to getting your paperwork turned in. So if you're considering this, I would start reaching out to faculty members unless you have found an opportunity that I had sent to you. But you'll want to directly reach out to the faculty members, and remember to be professional when you reach out to them to make a good impression. And I would recommend including your resume and CV in this. So this is a tip from Emma, who graduated in class of 2016. She shares that if you're interested in a topic or in working somewhere, send your resume to the professor studying that topic. Put yourself out there. It can only benefit you. And I think that's a great piece of advice, is to really put yourself out there. Don't be afraid. Don't be intimidated by the faculty. They're here and they want to help you. Sometimes they come off as being extremely busy, but they always have time to help out a student who shows the initiative and the drive. Another question we get quite a bit is information on double majors. So with the global health major, it's actually very possible to do a double major and be out within 4 years. It may take a little more planning if you're a transfer student. It may extend out to 3 years. It just depends how many of the lower division courses that you have done and also the GEs that you have done. So you have to have a 2.5 GPA, and you have to have more than 90 units, but less than 135 units to apply. So there is a sweet spot of when you can apply for a double major, and you want to start planning out as early as possible. So start mapping out your courses. It's recommended that you have all of the lower division courses complete before you apply for a double major. And so you'll have a double major petition form, which is available online. And you'll also submit a brief statement of purpose of why you want to complete the 2 majors. And you'll meet with both advisors from each department to review the form. And then after you have the approval from both departments, you take the form to your college, and they have the final say. When it comes to a double major, all lower division courses can overlap. So that's the case for any requirements at UCSD. All lower division courses overlap with your major, your minor, your GEs, etc. When you're doing a double major, you can overlap likely some upper division courses as well. It usually works out to be about 2 upper division courses if they're compatible between the majors. The requirement is that you just have to have 10 unique upper division courses. So for global health, you might have 12 upper division courses for the major. So that's why you could overlap 2, because you would have 10 unique and then you could overlap the 2. So when it comes to looking for compatible majors that are good for a double major, it really, any class or any major that has some courses overlapping with global health is a really good way to start. So because we're so interdisciplinary, you're going to be taking classes in biology, psychology, anthropology, sociology, history, public health, So any of those are really a good place to start if you're looking to get out in a good amount of time. And that's one thing you do have to keep in mind when you're double majoring is the university does not want you to stay here longer than your 4 years. And for transfers, they sometimes do make exceptions for you to stay 3 years, but you just need to have very good planning on that. So PreMed is another hot topic. We have many global health majors and minors who are on the PreMed track, and being on the PreMed track means that you're completing some of the prerequisites to apply for medical school in addition to your major requirements. So there are a few major requirements for global health already that are knocking out those PreMed requirements. So if you look at the schedule here, the classes in light blue are overlapping with PreMed and with your global health major. So there's information online on the global health major page of some of those PreMed requirements, but your main resource on campus is going to be HealthBeat. So HealthBeat is, as it says, the pulse of health professions at UC San Diego, and they're the global health PreMed advisors at UCSD. And you're going to want to meet with them early on. And also they have a newsletter that you can join, and they'll send you opportunities about research experience and volunteers, and they might have guest speakers and health panels. Most of the information they share there, we're also going to share with you in our Global Health newsletter if it's relevant, but we understand not all Global Health students are pre-med, so I would advise to also be on the HealthBeat newsletter. So you're going to want to really begin exploring early on, attending events on campus and webinars and network to make sure that pre-med is really the right choice for you. You might realize once you're farther into the major that your passion is being drawn somewhere else. So if you go to the Global Health major page, there's actually a section on pre-med, so at the very bottom here, under resources, and it has an overview of some of the pre-med prereq requirements. One thing to note is that not all medical schools have the same requirements. So this is just to be guided by. You're going to want to do some research on the program that you're actually interested in. And then you're also, like I said, going to want to meet with pre-med advisors. So they have walk-in advising. You're able to email them with quick questions. So if you have a quick question, you can email them at HealthBeat. So all the information is on their website to kind of get you started on that. Okay, so now we're going to talk about actually planning out your coursework, which is a pretty important part of your journey here at UCSD. So there's two ways that you can do that. We have the Global Health Undergraduate Degree Check, which I would highly recommend using, and this is something that we'll use as a tool in our advising sessions as well. So the Global Health Undergraduate Degree Check is available on the major page, and I would recommend downloading it onto your computer and actually typing out some, checking which courses that you already have done, and then saving it into your Google Drive. That way, when you come into your advising sessions, then you can pull that up on your Google Drive, and we don't have to complete the same form every time that you come in. So kind of utilize that tool. So if you've already completed the sociology requirement or you're doing it in fall, you could do Soci 70 and start tracking your progress that way. Another tool available to you is the degree audit. And this is UC San Diego's official tool to track your progress. So it's good to have your degree check, but in addition, you're going to want to cross-reference that with your degree audit. So the degree audit can be found in Triton Link. So Triton Link's your student portal. So when you get in there on the right-hand side, there's a section, a menu option over here. You're going to want to click on Triton Link Tools, and then you'll click on your degree audit here. So that's how to access it. And so this measures your progress towards completing your GEs, your major, your minor, your DEI requirements, and all that. So once you actually get into the Triton Link tool, it's going to ask you if you want to do a short form or a long form. So the short form is just going to show you your remaining requirements in the most simplified manner. The long form is going to show you your remaining requirements, and then it's also going to list out the courses that can be used to complete that requirement. So you're going to want to click on short or long form, submit audit, and then you'll have to wait a few seconds because it takes a minute to upload, and then you'll click view report. So this is what your degree audit will look like here for the global health section. So on the left column, it's going to show your major requirements. And then in the middle, it'll show your college requirements. And then additional requirements are going to be on the right-hand side. So for today's webinar, we're just going to focus on your major requirements. So as you can see here, it has the 3 lower division requirements. So if you've completed the course, it should be showing under here. So say you took FMPH 40, which is the class accepted by petition for HILD 30. It won't automatically populate in your degree audit until you submit a petition. So that's why it's really important. And don't worry, if something's not showing up here, send us a message in the back and we're going to help you out. So never be freaking out about that. So requirements in blue, categories in blue mean that you've completed the requirements. So on this degree audit, all lower division courses have been completed. If the category is in red, that means you're missing requirements. So here you can see of the core courses that the student is missing 2 courses. So they're missing their, in this case, it would be there's 2 senior capstone courses. And then here they're missing medical social sciences. And then if it says work in progress next to the course, that just means that you're currently completing the course. Another thing to keep a lookout for, so your field experience requirements. Your field experience doesn't have to be credit bearing. It actually doesn't matter if it's credit bearing for your degree audit. There is a process for submitting verification of your field experience hours. And once you do that, this will show blue and it'll show how you've completed your field experience. But until you submit that letter of verification, this area is going to be red. So something to keep in mind. So now that you know how to see which courses that you need to take for the major, now it's time to start kind of mapping out what courses you're going to be taking. So as you can see, one of our alumni here, Ashley, says, try everything from psychology classes to anthropology to literature. Be a Renaissance scholar and know a little bit about everything. So to see what sort of options that you have on for the upcoming courses, there's a current course offering page on the website. So if you go to courses, then course offerings, you'll land on this page. And this is where we outline all the courses that are tentatively going to be offered for the upcoming year. Now, things can change, so always have some backup plans in terms of electives. We tried, to keep things consistent, but we're not in control of other departments' offerings. The tentative annual schedule is really valuable. So you'll want to click on this, and this is going to show you for the whole year what courses are being planned to offer. So a good idea is to initially look through this and start, finding classes that sound interesting to you. So maybe it's global health and inequality in fall quarter. So maybe write out a rough draft schedule of courses that you're interested in for the year. And then, so there's that. And then in addition to that, there's a grid on here that shows you when all the core courses are going to be offered. So for the HILD 30 Global Health 20 requirement, there's offerings every quarter. The Global Health 148 course is offered in fall and winter this year. And then MGT 173 is offered in fall and spring. And then we have our Global Health 181 in spring. So these are things that if you know you're going to be taking your core courses this year, then you're going to want to mark that on your degree check, kind of do like a tentative schedule saying, okay, I plan to take Global Health 148 in fall and in winter global, or in spring Global Health 181, so that you're definitely going to be enrolling in those courses. And then each quarter we send you, the more concrete version of the course offerings that quarter, so you can go through and, okay, I know that I checked my degree audit and I know I need one more medical social science elective. So you can go through and, there's a new global health special topics course, demography and social networks and global health. So you can kind of plan out to take that. So you're never really on your own when it comes to picking out courses. We provide all these resources so you can just go and pick what's calling to you. So that's always really valuable. So here's an example of a 4-year plan for a global health major. So just a few things to note is that you're going to want to finish all of your lower division requirements as early on. You want to get those out of the way. There's no prerequisites for any of the global health core courses, but it's just good to have that foundational knowledge prior. Now, that doesn't mean that if you have to take Global Health 148 in fall and HILD 30 in winter that you're doomed. We just recommend that you take the lower division than the upper division. Another thing to note is that you want to complete all of your upper division and lower division core requirements as early on as possible. So with your upper division requirements, since it's upper division standing, you can't enroll in them until you have 90 units. So most transfer students who come in will have 90 units. If they don't, then they'll have it shortly thereafter. So typically you would enroll in your upper division core in your junior year. And then another thing to note is that your field experience must be completed before your senior capstone, because most students are going to be using that experience to kind of guide their senior thesis, however not required. So the things to remember are complete all your global health core courses early on, and then have many elective choices ready when registering from quarter to quarter. So sometimes, you might plan on taking a global health elective that overlaps with the core course. So obviously you want to, prioritize the core course and find another elective. So here's a sample to your plan for global health majors entering this year. So you'd want to get your stats requirement done, your Health 30 or your Global Health 20 course done early. And as you can see, if you're coming in with just 2 years to complete the major, there's quite enough room to fit it in all in time. And then if you have any GEs to fill in, then there's still room. So being a full-time student would be taking 3 courses. So each course is 4 units. So that would be 12 units total. I would highly recommend during fall quarter that you only want to take 12 units just to get acclimated. UCSD can definitely be a challenging environment until you kind of get the routine of it and understand better ways to study and whatnot. And then it also really helps to just enroll in classes that you are really interested in. So you usually do better in those classes. So if you're a transfer student coming in and some of your courses did not appear on your UCSD academic history, so some of your transfer courses, the admissions office is who you're going to want to contact about that. And then we also have a transfer page on the website that is going to give you some more information. So I would check that out as well if you have more questions. So some of you may have taken AP courses or you have transfer coursework. The 2 AP courses that could be relevant for your global health major will be AP Stats. So you have to have received a 3, 4, or 5 to get credit for your AP Stats. That should automatically count on your degree audit. If it didn't, go ahead and send us a message in the back. And then also, if you have some transfer coursework, as you can see here, so this is a snapshot of your UCSD academic history, and it'll say, okay, the course that you took, where you took the course, and then on the right-hand side over here, it tells you the UCSD approximation. So here, if it gives you the UCSD approximation, so Build 26, that's a course here at UCSD. So you don't actually need to petition the course. Build 26 and Build 18 are already accepted for the global health biological science electives. So they should already be on your degree audit. So maybe you want to check your degree audit and see if any of your courses have already counted. And same with the stats course that has Psych 60. And then also to reiterate, all community college transfer coursework comes over as lower division, so it may not be applying towards certain electives. So we had discussed that some of the courses that you might see on the schedule of classes are accepted by petition. So we're going to go over the process for submitting petitions for the Global Health Program. And please note that this is the requirement specific to our major. This is not the same process that you would have if you submitted a petition to your college. So the colleges all require you to submit a paper petition. And we're trying to be a little more environmentally friendly here. So we have an online petition request form. So if you are looking to petition a course, say that is accepted by petition, or it's a transfer course, or say you have a pre-approved, you're coming back from study abroad and you already have the course pre-approved, this is where you would submit it to show up on your academic record. You can also request pre-approval for a transfer or UCSD course, and then any other one-time exceptions or petition request would be on this form. So you can find that under undergraduate program, and then you would click on petitions and forms. This is where you can find most of the petitions and forms here, and then submit online course petition. Also, if a course is pre-approved or accepted by petition, you can just send us a message in the back and say, please accept this course towards my global health biological science requirement. So that, for example, if we're looking at the major page here, let's see, and these courses here, AMBI 134, accepted by petition. So you could send a message in the back and say, please accept AMBI 134 towards my global health biological science elective. And then we'll go ahead and update your degree audit and let you know. So that's kind of the quickest way to get a petition processed for the pre-approved courses. So let's move on to the field experience requirement. This is one of the most exciting parts of the program and a chance for you to actually get some hands-on experience in the field. So it's designed to enhance your knowledge, skills, and sensitivities, engaging your mind, hands, and heart to create a learning outcome that is scientific, pragmatic, and humanistic. So this is where you're really going to be seeing some global health issues in practice. And some of these opportunities that you might be involved in might just be an internship, research, a volunteer opportunity. You might be in a study abroad program that has a field experience component. So we'll get into what some more of the options look like in a moment. Let's just go over some of the requirements to get started. So as I said, it's 100 hours. And if it's domestic, it must be over a 5-week period. If it is international, it can actually be over a 3-week period, because we understand that if you're traveling, you're probably fully immersed. So it can be as short as 3 weeks. And you'll be keeping a log along the way. So it's going to be based on how many hours you're putting in a week. So just because you do 5 weeks doesn't mean you've completed 100 hours. It's just saying that you that's the minimum amount that you can participate to complete those hours. It can be domestic or international. The one thing about the global health field experience is that we live in such a diverse community right here in San Diego. We have Hispanic population from the border communities. We have the refugee populations. We really have a melting pot here in San Diego. So you can see global health issues in practice. And, the U.S. is part of the globe. So when we say global health, it's more about how you look at issues at hand. So it's understanding that there are other factors affecting health outcomes rather than just the basic scientific facts. And then, so it can be credit or non-credit bearing. If it's credit bearing, it's usually fulfilling your medical social science elective. And then it must be pre-approved. So we have a list of pre-approved options, or there's an opportunity for you to request pre-approval for an experience that's not already pre-approved. And then we also have a health and safety training that students need to review before beginning at their site. Okay, so a couple quick facts is that you have to complete the field experience prior to beginning the senior capstone, which is going to be during your senior year. You may participate in a maximum of 3 experiences. So you can combine up to 3 experiences to get your 100 hours. So when you complete one segment of a field experience, you're going to want to submit verification for each one. So you would, if you're doing 3 experiences, you would submit 3 field experience verifications. And then, as I said, it must be at least 5 weeks or 3 weeks for international. Okay, so when it comes to actually getting started on completing the field experience requirement, the step number 1 is that you're going to start researching what your options are and start thinking about what really resonates with you and what's going to benefit your career. So if you're on the pre-med route, you're going to want to get involved in research or clinical practice, because that's what those schools are looking for. If you want to get involved working with a non-government organization, so that's an NGO, then you're going to want to contact some NGOs locally or look for internships that are relevant. Use this to, increase your resume. So we have a lot of opportunities for you to find your field experience options. So, attending events on campus and networking. The Global Health newsletter that you're going to receive monthly is a gold mine of opportunities. So make sure to really read through that. You're missing out if you don't. We've had students get plenty of opportunities, paid internships, jobs, etc. So don't discount that. And then if you don't find anything that fits your needs, that's completely fine. We have an option for you to create your own field experience. You would just have to submit information on a form online, and our director would review that to approve or not approve. And then once you've identified the opportunity, you get started by reaching out to the organization. So it's, we don't make the contact for you. You're going to reach out to them, and you're going to want to be professional, include your resume, tell them that you're a global health student at UC San Diego and that you're wanting to gain experience in this area and that you have a field experience requirement and you think this is the perfect opportunity, and share any past experience that you've had with them. And then if they accept you, you'll go ahead and get started. You don't need approval from us if they're already pre-approved. And then you'll log your hours along the way. And you'll also review the health and safety information page. So all this is online on the Global Health website as well. So, and then once you complete your hours, you're gonna submit your letter of verification. So finding your global health field experience. There's a couple of ways to do this. So as I said, attending events on campus is extremely valuable for networking. You want to go ahead and definitely talk to other global health students who have more experience than you and who heard from other students and know of other opportunities. So definitely get social. We have a global health field experience Facebook page. So we have 2 Facebook pages. We have the standard global health one, and then we have one page that's specifically devoted to global health field experiences. So let's see. So if you're on this page, you'll see this is the main picture here. And oops. So you can see here that I'll post information about scholarships, internship deadlines. UCDC is a policy internship opportunity in Washington, D.C. There's all these different programs and deadlines. So if you're into social media, this is a really good place to be looking as well. We also have a global health program blog. And so you can find the links to all this on the front page of the Global Health website. The Global Health blog, we do a lot of blog posts, and we spotlight this also in the Global Health newsletter that gets sent out monthly. We'll send out some of the spotlights here. So if you're in MGT 173 this fall quarter, you can read Ashley's, who's an alumni now, How to Succeed in MGT 173. We have spotlights on students going abroad, on alumni, some student orgs that you might get involved with for your field experience. So this will get really active once the school year begins. And you can kind of look through and see what some other students have done in field work. And this is going to be constantly evolving. So check back here. And then also talking to your professors. So whether it's to get ideas from them, good organizations to be contacting, or getting involved in research with them, you don't know until you talk to someone. So I recommend putting yourself out there. And then also on the Global Health website, we have the pre-approved opportunities, and it's quite an expansive list here. So if you go to field experience, pre-approved opportunities, so you can see here like the pre-departure health and safety page, so we'll need to review that. But we have a list of all of the pre-approved, so these are the organizations at UC San Diego. So some of them we're going to go through a little bit more in detail, but all of the links are here. There's pre-approved student organizations, research centers, departments. So these are, most of these are from independent research. And then there's also a list of all the community organizations that are pre-approved. So anything from working with seniors to Feeding America, to the American Cancer Society, to Hearts for Refugees. And then we also have a list of all the clinical pre-approved options, and then some internship programs. And then if you keep scrolling down, you're going to get into the international section. So there's UCEAP, which offers study abroad programs with specific global health programs. So in Botswana, Ghana, Israel, you name it. And then there's also some global seminars. We'll get into that shortly. But then there's also some non-credit bearing opportunities and outside UCSD opportunities. So I would sort through this list and start brainstorming. You don't have to figure it out right away in fall quarter. You're just going to want to start getting ideas and asking questions. Okay, so for those of you looking to create your own field experience, there is a form online under the Field Experience tab, and you would just complete this form online. It usually takes 1 to 2 weeks to get a response from our director, so that's how you would go about that. Additionally, there is on the Global Health website a page on submitting your verification. So field experience, submit verification. And this is all the information. It includes the log on here to track your hours. And in addition to the log, you're going to want to, there's two options. You can either have your supervisor sign off on the log and submit that to GHP Advising or bring into our office, or they can send a letter or email to GHP Advising with the following information here. So there's those steps. So we're going to go over a couple special programs that you can get involved with for global health. One of those is, and you all have likely received the email from me with the upcoming deadlines, is the Health Frontiers in Tijuana internship program. So this is something that runs quarterly, so you don't have to apply for fall. You can apply for each quarter. You don't have to get involved right away. Maybe you want to come get adjusted at UCSD. And a lot of global health students are involved in this clinic. So it happens quarterly, and you're involved in a free clinic project in Tijuana. So on Saturday mornings, you'll go to the Tijuana clinic and you'll be volunteering there. And 2/4 of that completes the 100-hour field experience requirement. And there's also the UCSD Blum Cross-Border Initiative. This is something that gets sent out in spring quarter, and it's a summer field internship where you actually get paid $3,000 as a stipend. So it's 8 weeks long, and you're going to be doing supervised field work. So some of the issues addressed are poverty and social equity at the San Diego-Tijuana region. We also have global seminars, which is a form of study abroad at UCSD, going on a 5-week summer session abroad with the UCSD faculty. And this fulfills some of your course requirements, and also some of the programs do fulfill the field experience requirement. So as you can see here in this health category, so there's a program in Greece, a program in Australia, and a program in Thailand. The program in Thailand is the only one that fulfills your field experience requirement. You can still participate in the other ones if you want, because they do fulfill major electives. But each year, these also change. So this year, it might be a program in Thailand. Next year, so this past summer, there was 2 programs in India focusing on medical anthropology and human rights, and they got to meet the Dalai Lama. And in the past, they've had a public health and epidemiology in Jordan, Amman, Jordan. So that was another popular one. So just kind of keep a lookout. It'll be in the newsletter of all the new programs. So that is another option. So as I showed you on the Global Health website, there are other options. There's student orgs that you can get involved with. Alternative Breaks is one of them. They go on a spring break trip, and it's a service learning trip. They have over 20 locations that you apply for, and they range from anything working with homelessness or mental health or sustainability projects. And there's usually a lot of fundraising involved with those, so it's less of a financial burden. The Flying Sams at UCSD is another group that it's student org on campus, and they do clinic trips to Ensenada. So that's if you're looking for a clinical opportunity. CFHI, Child Family Health International, they're another program that they don't offer course credit, so they're a little cheaper, but they offer field experience opportunities over like winter, spring break, summer. So you can go anywhere from 2 to 16 weeks, and they have programs in all the countries. 10 countries, and they keep adding them. So they have anything from reproductive health to HIV/AIDS. So there's more information on that on the Global Health Field Experience page as well. So when it comes to the field experience requirement, I just want to go over a few things to keep in mind, and you'll all go over the requirements on the website. But the one thing that you need to know is that you're not doing the field experience to provide direct patient care, and you're not diagnosing or treating patients. You're there to learn. So you might not feel very valuable when you're there, but that's part of the process, is that you need to be more observational. You can definitely help with kind of like intake advising with patients or shadowing and whatnot, but you really should not be giving shots, delivering babies. You're not qualified to do that. So please do not, even if, sometimes if you do these international programs, they will tell you it's okay, but just know that it's not. And, part of the Global Health Program is we want to develop ethical individuals to go out into the world. So that starts here and now. So something to keep in mind. Okay, so let's talk a little bit about study abroad. I would say 30-40% of our students at least attempt to go abroad, and there's many ways to do that. So Venice here, we did a spotlight on her. She was in UC-EAP in Thailand, and her tip is step out of your comfort zone, embrace ambiguity. I would have never imagined myself living in an isolated village in the mountains, showering with a bucket and eating farm rats. So that might sound a bit extreme. So maybe that's not for you, but I know some of you really want to push yourself and, go see how other cultures are living. So this is a great opportunity to do that. Start planning about a year in advance for your your study abroad or your field experience, really. So if you're thinking you want to go abroad next summer, start planning in fall. And there's going to be a study abroad expo in fall quarter. We're going to talk about it a little bit more. And this is an opportunity for you to go meet with some of those study abroad programs and find out about timelines and scholarships and course approvals and whatnot. So on the Global Health Study Abroad page, we do have a lot of courses pre-approved, but you're also, there's an opportunity. So if you go to study abroad, there's here course pre-approval request. So if you're considering a program and you're really serious about it, you can start submitting course pre-approval request here so that you can get them pre-approved. And then when you come back, you would just submit a petition to get those on your degree audit. So as I was saying, there's a study abroad expo. It's on Monday, October 23rd, and I would put this on your calendar now. This is a huge event. There's 50, 60, 70 study abroad partners who are there that have worked with UCSD before, and a lot of them have global health opportunities. So you'll be getting more information about this, but this is definitely a don't miss event. So when you're going abroad, as we said, you can do the EAP, which is like the UC programs. There's opportunities abroad, which are outside UCSD programs, and the global seminars. So this is an example here, this form of an OAP program. So this is SIT, Study Abroad. And you can see how many different programs they have. So in Argentina, Public Health and Urban Environments. Brazil, Public Health, Race and Human Rights. India, Public Health, Policy, Advocacy, and Community. They have programs in Jordan. So you're going to see a lot of these programs that you can get involved with. We do also have a field experience expo in spring quarter where we invite a lot of these programs to come talk to you in more depth about the programs. So the question of the hour is always, what can you do with a degree in global health? And global health is really an interdisciplinary degree that gives you a great insight into going into careers in whether you're pursuing your PhD or graduate training, research, teaching careers. But there's also a lot of different directions you go with it based upon your interests. So from early on, you're going to want to start thinking about what area of the world you want to make a difference in. So not all students are pre-med, not all students are going to be doctors who are going out and, working in third world countries or even locally here. There's other ways to change the world, and this journey is part of you figuring out how you want to be involved in that. So here's a list of a lot of the jobs within global health you can go into. So anything from a physician, epidemiologist, which works with statistics and evaluates the prevalence of disease reoccurring. So you can work in pharmacy, dentistry, nursing. We have a lot of students interested in nursing and midwifery. So there's also the research and policy aspects. So one big way to make a difference in health and the health of others is from the policy aspect. So you don't actually have to be helping with your hands, you can help with your mind and your actions. So health advisor, health educator. A lot of students are also going into program management, so working with an NGO. So if you want to get involved with the International Rescue Committee or the World Health Organization, working in project management to deliver effective healthcare, working with community organizations or nonprofit. Some students are interested in law or being part of organizations working with disaster relief. So after instances such as Hurricane Harvey, be part of the team that goes in and actually does an evaluation of the situation and comes up with effective strategies to help that community. And then community health workers. So I have a list here of the leading global health employers, and this is a pretty long list. And this is not the only the only providers options out there. This is just to kind of give you an idea of some of the organizations you could work with. But this is more at the national level. At the local level here in San Diego, in LA, in California in general, there's other smaller scale organizations you can get involved with. So the Bill and Melinda Gates Foundation, the CDC, the Center for Disease Control and Prevention, Department of Health and Human Services, Doctors Without Borders. Let's see, there's Save the Children, Planned Parenthood, United Nations, World Health Organization. So if you're planning to get involved in an organization like the World Health Organization or the CDC, those organizations typically like to see a master's degree. So that's something you're going to want to keep in mind, or you're going to want to have some really good experience. So maybe you're going to want to do a gap year and do the Peace Corps, or have some sort of experience like that. So you're going to need outside preparation or a master's degree, just to name a few. Before I move on to that, I just want to also show you there is a careers page. So if you go to undergraduate program careers, there is quite a bit of information here on careers in global health. So there's information on your pre-med advising and career services advising, but there's also career resources for exploring jobs within global health. And so here, how to get a job in global health, leading global health employers, drug abuse careers. This list keeps growing. So keep that in mind, check back, kind of be doing your research, and you'll be learning more in your classes too about different careers. So don't feel that you have to have it all figured out yet. As I said, you're on a journey. So kind of let the content come to you a little bit, in a sense of finding out what really is you're passionate about. There's also a new resource here. It's a list of fellowship and postgrad opportunities. So if you're looking for fellowships in research, or if you're looking, even if it's a summer fellowship, so sometimes fellowships are paid too. So these are some that we have identified that are valuable, and we also try to include as much as possible in the Global Health newsletter. Okay, so now it's time to talk about tips for success. So getting involved is the #1 recommendation of being successful in college. It's going to keep you on track, and it's going to surround you with like-minded people. It's also going to increase your job opportunities. The more people you know, the more connections you have, the more opportunity there is going to be. So tip #1 is to be active in your major. So the amazing thing about the Global Health program is that all the students attracted to this major are extremely passionate. And passionate in many different areas, but this is very contagious to be around. So Crystal, an alumni, wrote, "Join the Global Health Student Org. Talk to professors and TAs about what they're passionate about in global health. Everyone is extremely knowledgeable and happy to help you learn and develop your own global health interests. Get curious and take initiative. Get an early start on planning your field experience so that you can fundraise and apply for financial aid." So you can get financial aid for some of the study abroad programs. And we've also been seeing some students do some crowdfunding. And you also want to attend and participate. So we have our quarterly conversations in global health, which we'll go over in a second. We have the annual Horizons of Global Health Research Symposium, and then the Global Health Field Experience Expo. And then we have other related events on campus that come through to you in your newsletter, on social media. And some of those things will be specifically within our program, but some of them will be through career services or other programs on campus. So there's going to be some career panels, some speaker series, some awareness campaigns to get involved in. So just put yourself out there, and also check your email. That is the #1 tip that I personally, as your advisor, have, is that so much good stuff comes to you in your email. If you're going to be prioritizing your email, always read the ones coming from the Global Health program, because they're there to help you. We try not to send out too many that aren't going to be of value to you. I know you get a lot of emails, but prioritize the ones from the Global Health program, and then follow us on Facebook as well. And then the first step that you can kind of get active is on Welcome Week, Monday, September 25th, we're going to be out tabling on Ridgewalk outside of REMAC. So if you're going to the Triton Power Hour, we will be outside. So stop by, say hi, meet some of the students. So we're going to have, this is a picture from last year, and the right here of participating in that. So you'll want to come out and say hi. So quarterly conversations in global health, our first one of the year is for fall, is on November 8th at 3 p.m. It's at the Great Hall, which is also in ERC, slightly pretty close to REMAC in the Global Health Advising Office. And we're focusing on child and maternal health. So you guys help us pick the topics each quarter. So this is kind of what you guys showed interest in. So each quarter it'll be a different topic, and we bring in professors and researchers and like the executives of organizations locally in the community who are doing work in that topic, so you can come hear about the work they're doing. And then we also have so right when the event starts, we have a half hour of tabling. So we invite organizations who have opportunities for field experience positions for students. So if you come early and start networking, you might find a job, you might find a field experience opportunity, you might talk to a really cool global health student. We have a global health table there with reps, so you can talk to some of the reps, some of the student org members. So I would highly recommend this. And a lot of your classes are going to offer extra credit, so I know you'll be there. So the next tip is to get involved with the UCSD Students for Global Health, or a health-related org, because as I said, it's very important to connect with like-minded students and get involved in a cause that you care about, and also to network. The Students for Global Health are awesome. They do awareness campaigns, they help put on quarterly conversations, they try and help the global health student body. So that's really important. You'll definitely want to get involved with them, and you'll be hearing more about that. So as I have said in many forms and fashion, social media is a way that we also share information. So we know that attention spans are declining, so we're trying to find ways to connect with you guys. So if you see something we post on Facebook that you think is cool or relevant, give us a like so that we know what kind of stuff that you guys want, because we're here, we're student-centered, the Global Health Program, we're here for you guys, and we want to make your journey the best. So anything that, the more guidance you can give us and the more feedback, the better. So, reading blog posts, you'll find study abroad opportunities, just get connected. The next tip is to form relationships with your global health undergraduate student advisory committee and faculty. So we have some GHP reps. These are the reps from last year on here, and we'll be announcing more information on the new reps. But we hold events such as bagels and office hours or peer mentor lunches where you can come and just ask students questions, because sometimes you have questions that are not as relevant for your advisor. Say you want more of insight about a specific class or faculty member. Then they would be a great person, a great resource for you. So Serena shares, don't be afraid to talk to your professors, talk to them about the class, their careers, anything you want. They'll give you great advice and even opportunities. So the final tip is to remember to take care of yourself throughout this whole process. So UCSD can really be a challenging environment for a lot of students, especially in their first year. You're used to being really good in high school or at community college, and you might come to UCSD and not do so well in your first class, despite all of your efforts, because you weren't prepared with the way that the testing was or how to study. So remember to just be taking care of yourself and not get too hard on yourself. There's always time to recuperate. And most importantly, you want to remember your purpose and why you chose to come to UCSD, and try and find meaningful work within your major and your field experience and connecting with other students, because sometimes you're going to get discouraged. And when you're discouraged, you might feel, why am I here? And that's when it's really important to remember what your purpose is. You have a reason why you're here, and you're going to be valuable to society, and you're going to give back to this world. And sometimes the road's a little bumpy to do it. So if something isn't working, change it. If you know that you're not good in psychology courses, take some courses in anthropology. Kind of find your style, make change. You can't expect, if you don't make change, nothing's going to change. So that's something important to remember. And you don't have to have it all figured out yet. So you don't need to know what you're doing after graduation yet. You don't need to know all the classes you're going to take for the next 4 years. Kind of live in the moment and let yourself be guided. Be open to opportunities. There's going to be so many opportunities at UCSD. It's unbelievable. You're going to almost be overwhelmed. Be open to that. And set small, attainable goals along the way. And if you're struggling, advocate for yourself and get help. Don't sit in your room. Don't let your grades suffer. Get out. Talk to students. Talk to your advisor. UCSD has many resources for you. So they have CAPS for counseling, OASIS for help with your writing. You can go talk to your professors during their office hours. You can reach out to global health students. You can come in and talk to your advisor. So most importantly, just take care of yourself while you're here. Take time to relax, enjoy, we're right by the beach. It's a beautiful campus. Go on a hike, get out. So just be very aware of that.